Hello all, my name is Dr. Pramod Bhilare. I am a spine specialist at Sancheti Hospital, Shivajinagar, Pune, as well as Sancheti Spine RX Clinic, Turk Road, Pune. So my motto of coming today and having a discussion is today, like every year on October 20, we celebrate something called as World Osteoporosis Day. Now, osteoporosis has been a really silent disease and it is actually considered a disease of the decade. Now for last 10, 15, 20 years we are seeing a growing populations in all parts of the countries, and not only in our country but worldwide. To give a brief account of what is happening on a world map, so 1 in 3 women as well as 1 in 5 men above 50 years are affected by osteoporosis and had at least one fracture in their lifetime. Now this is a huge number, and we need to definitely do something for it. So prevention is a key. Whenever you talk about osteoporosis, you need to prevent the setting in of osteoporosis. Whenever osteoporosis sets in, it grows faster and it keeps on growing because age is something which is not in our control. With anti-osteoporotic treatment and some anti-osteoporotic medications, it can be controlled, it can be very well treated, but prevention will always remain the key. So here we are not only talking about prevention of osteoporosis, but also prevention of fall to prevent any fragility, which are the osteoporotic related fractures. So very important is having a very good calcium in your diet. So it can be in the form of diet, it can be in the form of supplementations. So patients or elderlies who are not having calcium very well in their diet need to sort supplements for calcium as well as vitamin D. So vitamin D is very important cog in the wheel. You need to have a very good vitamin D enriched food as well as a very good sun exposure to develop vitamin D under your skin. The another important thing is regular exercises. Very important to stay active, to do weight bearing exercises, to do muscle strengthening exercises, to do gait training exercises, and also to do balance training exercises. So these are all important to prevent your bones to undergo osteoporosis. The another prevention you need to do is actually preventing falls. So if you prevent these falls, then you are definitely trying to prevent the fragility related fractures. And mind you, fragility related fractures need not have a very large fall, may not have a very high velocity trauma. A simple fall from a chair or not able to sit or a bump while driving via bus or a rickshaw can lead to these fragility related fractures. So preventing fall is another important. Certain tips for prevention fall at home is you should make sure your room, especially for the elderly, to be illuminated even at the night time. So because many elderly, especially the males ones, they need to avoid their bladder twice or thrice in the night. So if the room is not illuminated, they tend to fall and you can land up in fragility related fractures. Another important key is keep their bedroom as close to the bathroom as possible. Use anti-skid matting as far as possible. If you can illuminate the floor, which can direct them to the bathrooms. Also important is the eyesight. So as early as possible, you need to correct their eyesight. Many of them, elderly especially, can have retina or cataract related issues because leading to their eyesight problems. If you don't take care of this eyesight, they will tend to fall and ultimately land up in fragility fractures. Another important thing is stop all negative factors which can lead to your osteoporosis. So one of them is smoking. Definitely avoid smoking. Definitely avoid alcohol. These at this age group, especially in elderlies, can lead to fractures. Identify early identification of all the risk factors is again paramount importance. Something like females who have early menopause can have an higher risk of having osteoporosis. So for them, BMD scans or the bone mineral density scan, which identifies osteoporosis, where the T-score values is less than minus 2.5, is the definition of osteoporosis. So anytime it is less than minus 2.5, you need to sort out treatment. And not only minus 2.5, if it is dropping less than 1, you should be alert, start all these prevention strategies, and you should not land up in problem. So with this, I would conclude my talk, and thank you for a patient listening.